Well, thank you, Governor. Thank you for this opportunity to provide details, and also thank you for your continuing leadership as we, as all Marylanders, face this situation, and as we continue to stay informed. A couple things I'd like to characterize. As the Governor said, the situation in Maryland right now, as well as across the country, is one that remains at low-level risk, but we are aware and on the lookout if that should change. And so that is the kind of preparedness and mobilization response capacity in Maryland that Maryland Department of Health has been working on for many weeks now with our partners. That's partners in local government, other agencies, other state partners, federal partners, as well as very, very importantly in community and in the private sector. We will continue to keep you informed of all information as it becomes available. To start off with some counts, with some information about where we are in Maryland, we do not have any confirmed cases of coronavirus, the new coronavirus in Maryland. To date, we have now had 4 individuals who have met the testing criteria for coronavirus. Those 4 individuals have, 2 of those 4 individuals have been tested, the test results have come back, and those test results are negative. There are 2 other individuals who just today have met the testing criteria, so these are considered persons under investigation. So their specimens, too, will be sent to the CDC lab in Atlanta for that testing. That brings us to 4 suspect cases. Again, 2 of those have been ruled out and 2 now are pending. We understand that there may be discussions underway right now for a 3rd individual in Maryland today who may come forward and meet the criteria for testing. That has not yet been determined. So we have a situation not unlike our neighboring states in which we are leaning forward in terms of public health preparedness. And I'd like to give you some examples of what the Department of Health, as well as our partners, have been working on in order to assure the safety and health of Marylanders. First of all, very, very importantly, is continual communication with healthcare providers, whether that's clinicians, hospitals, or others around the state, so that we have 24/7 intelligence on individuals who may present, who may have symptoms, and who may meet that criteria for testing. Our public health laboratory, it's a state-of-the-art laboratory in Baltimore, is ready with trained experts as soon as we receive from CDC the materials as well as the clearance to go ahead and to be able to do this testing on our own right here in Baltimore, which will save some time. Our information technology department has worked very closely on software platforms so that we can monitor individuals as needed in their homes using remote technology so that we can keep an eye, a virtual eye, on people who may or may not be developing symptoms. Our preparedness and response team has been working very closely with every hospital in the state, with other healthcare providers, to understand exactly what their inventories are as far as very essential supplies, whether that's supplies to treat patients or, importantly, personal protective equipment, those kinds of supplies to make sure that healthcare workers are safe and that other patients are safe. As I mentioned, our local health departments have stepped up 24/7 lines in every jurisdiction. So if there should be a case at 2 o'clock in the morning anywhere in the state, there is an individual, a trained clinician who is available 24/7 to take that call anywhere in our state. We've worked very, very closely, as the governor said, with local school systems as well as universities and colleges in Maryland. We are blessed with terrific academic institutions who have come forward on their own and developed communication and preparedness plans for their academic community, for their students as well as their faculty. We are engaged very closely with federal partners on making sure that travelers who have come back from concerned areas in the world, particularly mainland China, who have come back to Maryland, are screened, and they are screened to be safe to return to their homes. And when they come back home, we continue to stay in touch with them for the duration of their quarantine period. And again, we have found remarkable cooperation across the state from those individuals. Lastly, we are developing contingency plans in the event that we have a number of people who are not able to be maintained at home. So we are developing partnerships, contractual arrangements for alternative housing, for transportation, and for support services if we need to take care of people outside their homes in other kinds of facilities. I can tell you daily briefings with multiple federal agencies so that we are on top of the latest CDC guidance, which is evolving, as is the outbreak. We are in frequent calls with state health leaders in every state that touches Maryland in the surrounding area. So while we're very, very busy at the state level, there's some steps that I want to remind Marylanders to take to protect yourself, protect your family, and to get ready in the event that your lives may be disrupted for some limited or perhaps for some longer period of time. First and foremost, stay informed, and do that with reputable sources. So cdc.gov, reputable source, health.maryland.gov. That's the homepage. You don't even need to go to /coronavirus. So it's health.maryland.gov is another reputable source from the state health department to stay informed. You know, the governor talked about flu, influenza. The way that this new coronavirus is spread is exactly the way as influenza is spread. So I want to say it one more time. Don't stop washing your hands. Wash your hands frequently. Cover your coughs. If you are sick, please don't come to work. Do not send your children to school. Avoid touching your face, touching your eyes. These are ways that viruses that may be on surfaces can be transmitted to us. So those are some of the basic preparations that we all need to be aware of and to implement in order to protect ourselves from regular flu as well as from this new coronavirus. It's also a good idea now to think about preparedness for your household. For you, if you need to stay home with your family, what would you need to maintain yourself for a period of time? So a home preparedness kit, not unlike what recommendations are when we feel that there may be a storm coming and there may be some people who are temporarily remaining at home. So there are things that to keep in mind, pain relievers, alcohol-based hand sanitizers, thermometers, non-perishable food. If you have pets or children, you might want to think about stocking up on extra pet food or diapers. There's a list of those kinds of household preparedness items on our website. Again, that would be health.maryland.gov. What we know about the vaccine, about the virus is evolving. We know that there's not a vaccine available, and we know that there's not a medication available. So those are two ways that this new virus is different from influenza. But again, we are learning every day more about how this virus is transmitted and how we can take steps to protect ourselves. It's not too late one last time to get a flu shot. I will tell you that we have many people who present in urgent care clinics, in doctors' offices, in emergency rooms with flu-like symptoms, and they have the flu. We have tested them and they have the flu. So this is still a period in Maryland where influenza is widespread, very, very active. And as the governor said, influenza can be a very, very serious disease, particularly for people that have underlying health conditions. What we have learned from the information coming from overseas is that it looks like the new coronavirus may disproportionately impact people who have chronic illnesses such as diabetes or cardiac problems, and may impact disproportionately older people. So with that, I wanted to keep you informed, and I appreciate the opportunity to share with you some of the activities just there within the Department of Health, and certainly with my colleagues across the cabinet, the level of readiness and preparedness that we are committed to in order to keep Marylanders safe and healthy in the future. So with that, I will stop here. Thank you.